Everybody, this is Dr. Stephanie, your double board certified critical care physician who works with physicians that are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. Tomorrow is National Women Physicians Day, and to celebrate, I've been doing a series of Facebook Live discussions talking about issues impacting women in medicine today. Last night, we talked about women in medicine, women physicians, the good, the bad, and the ugly. And tonight, our topic is Show Me the Money. And we're going to be talking about pay disparity between men and women physicians. So I have a couple of requests from you guys. If you're watching me live, just show me some love, say hey, and let me know where you're watching me from. If you like a comment, press the like button. If you love it, press the love button. And if you're watching this on replay, please press the replay button. And please feel free to share these videos across your other social media platforms and tag some of your friends if you think that you find this information valuable, which I know you will. So like I said, tomorrow is National Women Physicians Day. And last night, you can find the broadcast from last night. We talked about the history of National Women Physicians Day and Dr. Elizabeth Blackwell, who was the first woman doctor in the United States of America. We also mentioned Dr. Rebecca Lee Crumpler, who was the first African-American woman doctor in the United States of America. And we talked about some of the issues impacting women physicians and the women in the physician workforce. But tonight, we're going to talk about something that's kind of always been a hot topic, and that is the pay disparity between men and women doctors. In 2017, Doximity, which is a site for healthcare providers and physicians, did a survey about physician compensation, and their results were quite startling. Women physicians, they found, earned $91,284 less each year than men physicians. And that is a lot of money. And we're going to be kind of delving into the results of that study and its implications. But across the board, and this number has been replicated across the board, many studies, and it really does show that when you control for everything, control for specialty, when you control for experience, hours worked, years of experience, location, women physicians earn on average 27% less than male physicians earn. And like I said, this is across all locations, all specialties. And when you factor in other issues with compensation like RVUs, this pay disparity still holds true across gender. Now, here are some numbers I ran across per specialty, and they're quite impressive. So for neurosurgery, female neurosurgeons make $92,918 less than their male counterparts. Women thoracic surgeons make $81,594 less than their male counterparts. Female vascular surgeons make $88,800 less than their male counterparts. And the disparities continue even in primary care medicine. In internal medicine, women doctors make about $41,771 less than male doctors, and family practice physicians, women, make about $42,555 less than male physicians. And this was based on this study done by Doximity in 2017. So in every specialty, in every location, men physicians are paid more than women doctors. So why do you think this is the case? And there's a lot of discussion about the reason for this. Merritt Hawkins did a study in 2016, which they surveyed the average number of patients men and women physicians see during the course of a day. And they found that women physicians see 9.2 fewer patients per day than men. One of the reasons that they think this happens is because studies have shown that women tend to spend more time with their patients, more time talking to their patients, counseling their patients, educating their patients, more time concerned with things like socioeconomic conditions, preventive maintenance, preventive care. But the flip side of that is if you spend more time per patient, then you see fewer patients per day. And why does this matter? You ask. It matters if your pay compensation is based on RVUs, and the fewer patients you see, a lot of times the fewer the RVUs you generate, and that can translate into a lower salary. So that's one reason that they speculate that women physicians are compensated less than men, because maybe there's a productivity issue. But a study done by JAMA refutes this, and they say that even when you correct for, RVUs and other factors that go into determining a salary, women are still paid less than men. So women physicians are still paid less than male physicians when you take all of those other things out of the equation. So we know the problem. The problem is women physicians are paid less. We are still trying to figure out the reasons, but what can we women do about it? So that's what we need to kind of brainstorm and figure out some ideas. So we know the problem. So what are the solutions? Well, one of the solutions that everybody keeps saying is that we women need to be more comfortable talking about money. Now, I am Southern, as if, you guys can't tell by the accent and the fact that I got my Crimson Tide shirt on. I am a true Southerner. And, we were always raised that there's three things that you don't discuss in mixed company. You don't talk about money, politics, or religion in mixed company. And I think that this aversion of talking about controversial or uncomfortable subjects has really hindered women in our advancement in the workplace, because we are not comfortable about talking about money, or we don't want to bring money up in an effort to seem as though we are, polite. Men have no problems talking about that. And another thing that hinders our discussion about money is discussing salaries is prohibited in a lot of workplaces. But you have to think about this. Who is telling you that you can't discuss your salary? And it's usually the people who are in charge of determining your salary. And why is that? Because they don't want there to be any, grumblings amongst their employees when one employee finds out what somebody else is making. But if there's transparency in terms of the salary scale and the pay structure, then they wouldn't have to worry about that. So it kind of leads me to think that if they don't want you talking about salary, and if they discourage you talking about money and asking about money, that they maybe have something to hide. But that's just me. But like I said, women need to be more comfortable about talking about money. So how do we do this? First of all, you need to find out what other physicians in your specialty and your location are getting paid. And that's why Facebook and social media are so great, because even if you don't feel like asking the people that you work with these questions, you can join Facebook groups like mine. My group is Creating Careers in Medicine. And if you are a physician who is interested in locums, have career questions, I do encourage you to join that group. But there are so many other groups for physicians who are just looking for career advice, different things to do. And we routinely talk about salary and hourly pay and things of that nature. So you can easily find out what other physicians in your specialty and in your location and in other parts of the country are making. You just have to ask, because as you saw based on those numbers, there is a huge range of pay, a huge pay disparity between what men and women are making. And if women are making on average 27% less than men, that lets you know that there is a huge room for negotiating when we're talking about salaries. So this leads to my next point. Get comfortable with negotiating. So the thing is, there's a good saying that goes that if you want to grow and progress, you need to get comfortable with being uncomfortable. So for those of us who may be uncomfortable negotiating, well, be uncomfortable and just go with it. But know that the first offer you have with anything is just the first offer. You know, it's not final. There's always wiggle room, and men do this much better than women. Men are much more comfortable negotiating. They're much more comfortable asking for more money or more benefits or whatever. So women need to get comfortable negotiating. And this is something else that I recommend that everybody do, especially women. Stay in the job market. It is so easy that when we get a job, and even doing locums, you know, we got a locums position that we like. We're booked out for the next 6 months or 9 months with this same locums assignment. But sometimes you kind of get in a kind of lull, and while you're in this lull, you kind of don't realize that, things are changing. Dr. Ahmed says, good. Okay, Dr. Ahmed, what's good about it? Comment, talk to me. What are your thoughts here? But yes, stay in the job market. So, men will do this. A man who wants a raise on their current job will go interview with other jobs, get a better offer, and then play both offers against each other. And they do this all the time. Women, we need to learn how to do the same thing, because you don't know what the market holds unless you're in the market. That's one of the reasons why I like doing locums. I like doing locums for several reasons, but I think in terms of salaries, I think doing locums, your salaries, your compensation is pretty much more upfront. You know, I'm a critical care doctor. I do critical care locums. I work in shifts. They pay per hour per shift, bottom line. And if I don't like what one assignment is offering, I don't have to take that offer. But I talk to recruiters all day, multiple days throughout the week. And so I'm able to see what is this assignment paying, in this location versus this location. And I tell you, there's a wide range, but what I was making as a critical care doctor a couple of years ago, I'm no longer making that because the rates have increased. And the only reason I know that the rates are increased is because I'm actively in the market. So that's why I say, remain in the market so that you know what the market holds, what other jobs are paying, what areas of the country are paying more money. So that's how you are competitive, and that's how you make sure that you as a woman can get a competitive salary. So those are just some of the tips that we can offer, because like I said, the data is clear across all specialties, all locations. Women get paid less money than men. When you control for everything else, when you control for experience, number of hours worked, location, RVUs, all of this kind of stuff, when you take all of those out of the equation, men doctors are still paid more than women doctors. And until we can fix that on a structural level, we have to do what we can do to fix it on a personal level by making sure that we are getting compensated fairly, that we are getting compensated not just fair market value, but compensated what your colleagues are being compensated for, and that there's no discrepancies that can be attributed to your race or your sex, because those things do matter. But like I said, I am a locums doctor. This is one of the reasons why I like doing locums, because I think in terms of, what you get paid, it's pretty much upfront. And like I said, that's one of the reasons why I like to do it. So for those of you who are interested in doing locums, please download your free copy of my locums ebook at bit.ly/Dr. Stephanie Locums ebook. And we will continue to have more of these discussions over the next several days. In celebration of National Women's Day, we are going to talk about issues that affect women doctors. If you would like to get messenger notifications direct to your inbox, please sign up right here. Go to this link here to sign up for, like I said, messenger notifications, but be sure to download your free copy of My Locums ebook and stay tuned for tomorrow. We're going to be here the same time, same place, because we're going to continue our celebration of National Women Physicians Day. We're going to continue to talk about issues of women in medicine. I thank you so much for giving me your time on this Friday evening. Enjoy the rest of your evening, and we will talk soon. Thank you, and bye-bye.